Okay, so next up we're going to talk a little bit about the specific physiological effects that we get from phonophoresis, which again, using the ultrasound to drive medications through the skin into the tissue. So phonophoresis is the use of therapeutic ultrasound to assist in that diffusion of medication. Um, Benefits of using phonophoresis: it delivers the medication over a larger area than an injection would, right? So you would have the tiny little needle injection and then allow the body to disperse it. Phonophoresis would go a little bit larger than that. The cavitation that the ultrasound produces is believed to cause some small openings in the stratum corneum, which is that tough outer layer of the skin, all the dead cells. The cavitation helps open up that to increase pore size so that the medication can be delivered more easily. Um, there's several things that can affect how effective phonophoresis is. So basically the quality of your skin and the area that you're trying to put the medication into. So the hydration of your skin, so higher water content is going to be more permeable to the skin for medications to pass. That includes the lotioning and just having good moist skin is helpful. Age, so age causes dehydration, changes in your circulation and your lipid content. So all that would affect the composition. So there's easier passage of medication through skin near hair follicles or oil glands or sweat glands, sweat ducts. Although hair follicles encourage the passage of medication, if there's excessive hair, that would be a problem. So we should shave that off. So the pore is what we need, not the hair. Vascularity, so areas that have high vascular permutation in that area are apt to allow the transfer of the medication into deeper tissues easier. Constricted vessels localize the effects, whereas dilated vessels enhance systemic delivery of the medication. And then the thickness of the skin. So thinking about doing things at the bottom of the foot or on the palms, those are very rough areas and thicker skinned areas, so that's going to be potentially more difficult. So one thing that they found is preheating the treatment area with a moist hot pack increases that local blood flow, the kinetic energy, which is further going to enhance the delivery of tissues. So kind of like we talked about in the previous videos, that 15 minutes of the heat can just kind of help stimulate all of that. But then, like we said, also hydrating the skin. You wouldn't want to put lotion on right before you put the medication on, but making sure that they, in general, keep their skin fairly hydrated, as well as then just being hydrated, right? So drinking lots of water, things like that. So the ultrasound is going to move the topical medication. So it's something that needs to be able to be passed through the skin. And the sound waves help increase the cell permeability, helps to open up those pores to help the medication dive down deeper into the tissue. Success is really dependent on the ability for the molecules to cross those biological borders. So certain medications are going to be better than others. They have to have that ability to cross over the cell membranes already. Benefit is it's painless, unlike a injection. It's relatively safe, it's non-invasive, so we can get that medication to a specific location. Again, versus even an injection, versus having to take a medication, which would then have to go through your digestive tract, and that goes to the liver, so you actually lose some of the medication to the liver detoxifying your blood. It's what we call first pass metabolism in the liver. Now, why would we look at phonophoresis over iontophoresis? So phonophoresis sends in full molecules. So usually you might have to get a special prep of the medication, but we don't have to have it ionized. We don't have to know if it's positive or negative. Phono tends to also appear to go slightly deeper, especially because just like ultrasound, it doesn't affect the adipose tissue as much. So it can go a little bit deeper with phono than ionto can. The medications we typically use are either anti-inflammatories or analgesics, so hydrocortisone, cortisol, Salicylates, which are versions of aspirin, in this case, skin topical medications, dexamethasone or lidocaine for numbing. It may increase both the benefits and the risks of these topical drugs, though, too. So you need to know what are the drug effects, what are the benefits, but then also what are some of potentially the contraindications of the drug, because both of those might be exacerbated with an individual. You also do, just like for iontophoresis, you need a prescription from the physician if you're using a prescription medication. So by far, again, kind of the most typical, hydrocortisone is used to alleviate pain, reduce inflammation, usually used in arthritic conditions, maybe bursitis, tendinitis, TMJ. My mom actually used Phonophoresis for her TMJ using hydrocortisone. Dexamethasone, sodium phosphate, that is again another anti-inflammatory. That's best used with thermal ultrasound for about 2 to 3 days, research has found. Ketoprofen is another one used. So the salicylates, there's few studies on those, so that's kind of more up in the air as far as evidence goes. Lidocaine has been shown effective in treating trigger points as well. So one thing you have to be aware of, though, is how do you get the medication onto the body? So some medications will be in a medication prep, which is then it's mixed with some sort of fluid or gel that would make it more transferable for ultrasound to get through. You can't just use the medication straight out of the bottle or straight out of the cream pack. That's not going to, those creams and things are not going to be open for, to allow the ultrasound to be transmitted, right? We need that medium to allow the ultrasound transmission to occur. You'll do an activity for class, right, about looking at these different mediums and how ultrasound doesn't really transfer through those. So actually one of the best things that they've really been talking about now is if it's a topical medication, to just rub the topical medication in like you would. So if you're using hydrocortisone cream, you'd rub it in until you don't really see it, and then just do normal ultrasound over the top. Or you can even, if it's more of an open wound situation or an area where you'd want that medication to be able to sit a little bit longer, you can put the medication on, kind of rub it in, put a bioocclusive dressing over the top, so like Tegaderm or something like that, and then do ultrasound over the top of it. And then that way you can leave the Tegaderm on and let those pores, while they're open, because that stretch window, right, about 5 minutes after, those pores are still going to be open and they can continue to absorb, versus if we just did it straight to the skin, we'd end up wiping off whatever was there already. But basically that's what this chart is saying. So the pink up here is fairly good. So relative to water, we get 97 to 88% transmission. And so those are, here's ultrasound gel itself, ultrasound lotion, mineral oil. Again, the medications that end up being made specifically for phonophoresis, which are few and far between, okay, usually mixed with ultrasound gel, we get better results. If we try to just use creams or ointments or different things like that, we get very little transmission occurring to no transmission occurring. So we got to be careful about what we use. So thinking about phonophoresis, the biggest hurdle there is the efficacy of the coupling agents. So you can't use the straight up topical form of the pharmacological. You can't just put hydrocortisone cream on someone and expect to use that as the ultrasound gel. That's not going to work. So some of those medications are going to pede ultrasound. So that's that conversation that we'd want to rub in that medication first and then apply the gel. There's also debate on whether it should be pulsed or continuous on the effectiveness, and that's a little more inconclusive. If you think about it, using continuous ultrasound at thermal levels would be counter to the goal of doing an anti-inflammatory medication, right? If you're trying to put in an anti-inflammatory, we don't then want to use heat. So, you want to think about that. If the goal is to decrease inflammation, we would probably want to use more of either a pulsed ultrasound or use continuous ultrasound, but keep that spatial average temporal peak really low. So maybe we use 100%, but we only set our intensity at 0.2 or 0.3 watts per centimeter squared, so that we stay below the thermal stages, but we still get that long treatment, or the ultrasound stays on for 100% of the time. It seems to be that if the frequency doesn't matter as much, so 1 megahertz or 3 megahertz, it seems to be about the target. For the most part, a lot of people believe that the 1 megahertz, because of that longer frequency or the longer wavelength, allows the medication to drive a little bit more. But that's, again, inconclusive of whether either of them is really all that great. There's better results when we start talking about those long, or those low intensity pulse ultrasound units. So the 45,000 hertz or the 20,000 hertz results, those seem even better. So maybe having just like we have a special machine for Ionto, maybe it's best that we have special frequencies for phonophoresis. But it does appear the longer the wavelength, so in this case the lower the frequency, the better. So the 1 megahertz seems to be a little more appropriate. So again, if the goal is to decrease inflammation, again, we probably wouldn't want thermal effects. If the goal is decrease pain, then we would maybe consider using thermal in more continuous settings. But again, if we're trying to decrease pain, our cryotherapy tends to be more effective. Some of our eStim could be potentially more effective, and obviously, number one modality, if we can get them actually rehabbing. So again, you got to think about what is the goal for this patient. How would phonophoresis help meet that goal? So, think about all of that together.